matters afoot. And they had to attend to those urgent matters. So there's probably a lot of stuff going on. And we got our man on the inside, Dr. Hoa Nguyen here. Doc, they don't know you're zooming in right now, so we're good. I know that they're all in a big meeting at Adeloop, so you can go ahead and give us all the juice. We bring you on here. Good morning, Doc.
Hey, good morning, guys.
Good morning.
Good morning, Sabrina.
Good.
Anyway, there's a lot of confusion. The travel guideline, I noticed, is catch a lot of publicity right now. But
Yeah.
and we're going to have a meeting tonight with public health and everyone involved in decision making, and make sure we come out with a new guideline. Hopefully, we push to be implemented this week. Okay, so again, there's a lot of confusion. I read the JIC this morning. I read the order from public health, and there seems to be a lot of confusion in there. So we're gonna try to make it very simple and straight, and make sure everyone answers the question answer. Like I said, we really want to push it to change it this week. So hopefully the governor will bless it, and something official come out probably by the end of this week for everyone to follow.
Wow.
And our thought, get people home early, rather than 14 days. There's a science and an art on it, and I know I sent Chris a little reading about Hawaii, how they approach that thing, their proposal is, and it's just a science. So we're gonna follow the science, okay, and send people home early with some testing out date. It most likely, we really like to push the pack, like to push it this week. So again, we want to meet with Director of Public Health, get everyone on board the same page, so that way there's not much confusion out there for people to read.
So when you took a look at that Joint Information Center press release that was issued late last night, and the new amended guidance from Public Health, are you saying you were confused?
Yeah, I mean, I'm not quite sure either, but let's say the people that have negative PCR 5 days prior to arrival, that's negative can go straight home. And to me, we're not up to that stage yet. So I think that's something that I'm not sure I read it correctly, but it's not discussed within the pack on that type of move yet. So I'm not quite sure how to answer that one, but we have to somehow put it that public health and the pack on the same page.
Right. And you're right, Doc. I did read that part about the 5-day, I guess, test, whether it's a molecular or an antigen test, and it's required 5 days before arriving to Guam. And it did sound as though that you could get this test and then be able to home quarantine. But when we asked the spokesperson for public health, she said that it's still mandatory for the 14-day quarantine at the government quarantine facilities. So, yeah, I would really appreciate if you could get some kind of clarification and in the PAG stress that it has to be in just simple terms. What exactly is the protocols? And every time they change it, it just seems like they're just pouring on all these different codes and Executive Order 1458, all these different things that nobody really understands, and nobody really has the time to go and look up all these different executive orders and compare what's different, what's new, when all you really need to do is just tell us straight up, like, what do we need to do if we come to Guam? Can we home quarantine? Can't we home quarantine?
Yeah.
Do we need to pay for it?
It's really a failure on the comms. Whoever's doing the communications, you got to break this stuff down. Don't just skeet out a Bible-sized freaking executive order and then expect people to decipher it in minutes to tell people what has changed. I mean, it's simple. You just put out a new executive order. Here's what's different.
Yeah.
But guys, well, our goal is to get people home early,
Mm-hmm.
okay? And again, I think when I read about the blog is that the reason people, some people fight about it, they really, um, there's some data out there, some study out there, there's some guideline out there, there's some science out there, but the problem is we try to implement something and not explain to people of why we do that, and a long time ago, um, I sent Chris a curve. That's what we base it on, and that curve is everyone in the world follow that curve right now. When to test and the reason to test, um, and surprisingly, we 6 7 months into this pandemic, and a lot of people never know that curve exists and the reason why we make decision. Um, but somehow. We need to get that simple graph to come out so people know why we make decisions. So I think all of it is part of education to the public to know what the reason why we do that. A lot of people say, why do we test negative? And why can we go home because we're negative already before we arrive? And they know that curve. I think they will understand why the government doing it. So I think part of it is a fair education. The public, educate the public on why we make certain decisions. So we have to go back and look at that thing. But again, we're going to meet tonight, and hopefully there's a lot of positive change to come in. And again, we're going to meet to see if I'm pretty sure that a lot of business will come open. Hopefully during the peak one, so that way our economy can go forward. But
Hold
just
up,
this
hold up,
message.
hold up, hold up.
Hold on.
All right, wait.
Okay. And you just tried to slip that in there. Hopefully, a lot of businesses will open up so our economy will go forward. You can't just say that and then move on, Doc. What do you know? Come on.
Yeah, but right now is that the main thing I want to do is just to get it this morning and the guideline for travel guideline. Okay? And we've tried to fill you guys out by Wednesday or Thursday of what's going on regarding certain things that we try to change. So be patient, okay, until we get there. Okay, so just so
Let's
the,
just
the
be,
guideline right now,
Doc, just between, as friends.
it's not very good.
I know it's not your call.
Right.
But we're seeing, okay, the numbers were, they're lower. Hospitalizations, I mean, part of it's because people are dying, they're lower. But I see the writing on the wall, and I feel the immense pressure on the governor to kind of entertain all these valid concerns about opening more businesses during the peak or one. So that's a conversation that was supposed to happen last week. However, I know that you guys had other, public health issues on your table at the PAC, but that's the discussion this week, correct? Is what can we open by the end of the week?
Yes, that's you're correct. And I say, well, I wouldn't like I say, it had to be the home physician advisory group to give comment on what business are open or not, and then we recommend that to governor, and she
Right.
will approve or not approve. So that's the process will be. And everyone want to open. I want to open. So I think that we are in a position now that GMH have decreased in the census. They have some critical care nurse coming in. I think they have like 38 of them from the state are here. So it's a very encouraging that we move in the right direction. So as long as we feel like the hospital can handle the pandemic, we are ready to move forward. Again, they make a lot of change at GMH. They have some help from people from FEMA, nursing staff from the state. So we are in a more comfortable position now to move forward. So it's time to talk about other things.
Right.
Okay, but just hang on to the travel guideline. We really will sit with public health on the same table tonight, and we come out something that will make a lot of sense. Again, is just want to say thank you for all the people that in the quarantine. Especially, I forgot who this morning that you got interviewed, but thank you for understanding why they aren't. So it's just you hear on a different thought and the different people, and I really appreciate that he's that on the virus in the
Right.
community.
You're
So
talking about
I'd like to
our
say
interview with Kyle Logan, and really a different perspective in that he had said they don't view it as a prison cell. So I thought that was a little refreshing. Doc, we have Janela Carrera of Public Health. Did you want to jump on with her, or you got to go?
I gotta go see patients. So thank you guys for giving a few minutes, and we talk to you guys later on. Okay,
Right
thank
on.
you so much.
I'm sorry. Did you say that? Are you anticipating us to stay into P Core 1 with modifications for more businesses to open? Is that kind of what we're looking at?
Right now I don't know. No, I didn't say that. So,
No, but I mean, that's
we
something
have
that you guys are
meeting
maybe
back
recommending.
tonight. We will meet Sabrina with the pack at 5 o'clock tonight. And we will make our recommendation. Okay, so again, I don't want to talk for the packs, and I haven't listened to their own opinion yet. So I will wait until we have a chance to meet tonight. Okay.
Okay.
Thank you, Doc.
All right. Well, just send over the link.
Yeah, the Zoom link. Sorry about my friend Sabrina asking those tough questions.
That wasn't even a tough question.
Thank you,
Have a
Doc.
good-
You too, Doc.
Okay.
Yeah, tell your
Bye,
patients
Doc.
I said hi. Okay. Janela, we have Lieutenant Governor. He's right behind you in the KUAM News Zoom room where we sanitize our Zoom room immediately after every guest. So, Janela, if you don't mind, lift your arms up because our little sanitizing duendes are going around spraying everything. All right, they're good. And we're back. Janela, you texted me you wanted to jump on and offer a little more clarity on the new quarantine protocols, if you could.
Yeah. So when we had talked
Sure,
about
yeah.
the pre-arrival, the 5-day pre-arrival test, that's for people that are exempt. Or yeah, just
Right.
clarify.
Yeah. So I was kind of listening to you earlier there. So the key word here is individuals permitted to quarantine. So I just wanted to offer some clarity on that part there. These are friends who've already been given exemptions. So the scenario here would likely be those who have been granted some kind of exemption, for example, critical service workers, essential healthcare providers, those who have been granted some kind of emergency hardship request. And those are actually defined in this guidance. That's what this section is describing, that if you've already been granted some kind of, or if you've been permitted to quarantine at home, then you would need to have had a negative test result within 5 days of your arrival. So I just wanted to offer that clarity. I know that you're talking about it with Dr. Nguyen, and there may be some confusion, and you're not the only person who's brought this up. Just want to offer that clarity.
Okay. And again, just so everybody is clear, if you are coming into Guam, this 14-day quarantine at a government of Guam quarantine facility is still in place. If you're not granted,
Sorry, could you repeat that question? It might
for
slow.
everybody and anybody that is arriving into Guam will still be subject to the mandatory government of Guam, the quarantine in the government of Guam quarantine facility. That still applies.
Right. So that still applies. Of course, unless you're applying for an exemption request and you're granted approval.
Okay, I got it now. Unless, I'm sorry, what?
Okay.
Hold on, Janela. Chris has something.
We just had a comment. Just Percy writes in, I have a question. If a returning resident from Guam gets quarantined, who pays for hotel accommodations? And in what circumstance do people in quarantine pay? I guess is a better question.
So, as I had mentioned earlier, the government of Guam, for the most part, has been paying for the quarantine of passengers. There has been, I believe there have been situations in which, in previous instances, certain airline or crew members may have been paying for their quarantines, but I'd have to double check on that. But for the most part, arriving, especially returning residents, and that is borne by the government of Guam.
Okay. So nobody can come into Guam and home quarantine, even if they have a negative test. It's straight to the government of Guam quarantine facility for 14 days.
Right.
Okay.
With the exception, of course, if you've been approval, for example, critical service worker
Right.
or essential healthcare provider.
Or essential farmer.
Sorry, I didn't catch that.
Yeah, it's an inside joke.
Oh
right.
my goodness!
Okay.
Do you have any estimate, or maybe you can provide it to us later on just how much we've been paying for this for government of Guam, the government of Guam quarantine facility, and to have people in quarantine?
Yeah, I don't have that estimate. I probably would defer to Guam and security.
Right.
Okay.
Okay, Janela, we're going to go because we got Lieutenant Governor right behind you.
Okay.
Thanks.
Thank you for jumping back on.
All
Appreciate
right.
it.
Thank you, guys.
Okay,
Okay,
Esther.
take
Okay,
care.
wash your hands. 8:18. We'll just go right into the KUM News Zoom room with Lieutenant Governor Josh.